Chances are you're sitting down right now, probably slightly slouched. Maybe you're at your desk or commuting in your car or just relaxing on the couch.
Yeah, that's almost a guarantee.
Right. And while your chiropractor might be, pretty mad about your lower back, the actual victim of your bad posture is something you would probably never expect.
No, you wouldn't. It's your bladder.
Exactly. So that is the mission of our deep dive today. We are exploring a really fascinating stack of medical literature, biomechanical studies, and physical therapy guides to map out exactly how your posture and your spinal alignment affect the direction of intra-abdominal pressure.
Specifically on the bladder neck, which is a big deal.
Huge deal. We're going to uncover why the way you sit and stand basically dictates your pelvic health. And, why the standard universal advice to just do your Kegels might actually be making things significantly worse.
I mean, to really grasp what is happening to the bladder neck, we first have to understand the physical environment it lives in.
Okay, so set the stage for us.
Well, we need to reframe how we think about the human torso. So moving away from just thinking about surface muscles and looking at what the literature calls the core canister or the core capsule.
Right, let's unpack this core canister concept because I think when most people hear the word core, they immediately picture like a six-pack.
Oh, yeah, always.
They think of the rectus abdominis, just that flat wall of muscle on the front of the stomach. But the sources we reviewed paint a much more three-dimensional picture. Anatomically, your core is a pressurized cylinder.
Yeah, think of it as a sealed functional unit, right?
Yeah.
With four main borders. So the respiratory diaphragm acts as the top or the roof of this cylinder.
Okay, so the diaphragm is the lid.
Exactly. And then the pelvic floor muscles make up the bottom, or the floor.
Makes sense.
Then wrapping around the sides, you have the transversus abdominis, which are, your deep abdominal muscles. And finally, providing the structural support in the back, you have the multifidus muscles running up your spine.
The analogy that kept coming to mind while reading the research was a sealed, pressurized soda can.
A soda can is a great way to visualize it. Or even a really thick water-filled balloon.
Right, because when you take a deep breath in or when you cough or, when you deadlift a heavy box, you are generating pressure inside that sealed environment to stabilize your spine.
And the medical literature refers to this as intra-abdominal pressure, or IAT.
IAP.
And that pressure is entirely natural and, necessary for human movement. But physics dictates that pressure has to go somewhere.
It can't just disappear.
Right. So in a perfectly aligned, healthy core canister, that intra-abdominal pressure is managed dynamically and distributed evenly. And this brings us to the specific target of all this pressure, which is the bladder neck.
The bladder neck being the specific junction where the bladder tapers down and meets the urethra, right?
Correct. In a healthy anatomical state, the bladder neck sits really high up in the pelvis. It is supported in what they call a retropubic position.
Meaning it rests securely right behind the pubic bone.
Yeah, shielded by the surrounding tissues. And this positioning is critical because of a concept called in-Horning's theory.
Yes, in-Horning's theory. I spent a lot of time reviewing this section of our sources because it explains the actual physics of how the human body stays dry under physical stress.
Yeah.
I mean, it operates just like a pressure valve.
It really does. In-Horning's theory is fundamental to understanding pelvic biomechanics. It basically proposes that when your spine and pelvis are in proper neutral alignment, any sudden spike in intra-abdominal pressure.
Like from a violent sneeze or something.
Exactly, like a sneeze or a heavy cough. That pressure is transmitted evenly to both the bladder itself and the proximal urethra.
And just to clarify the medical terminology for a second for everyone, when the sources say proximal urethra, they're talking about the upper part of the urethral tube that is closest to the bladder.
Right, the part firmly inside that pressurized soda can. Because both the bladder and that upper part of the urethra sit within the same optimal pressure zone, the force of a sneeze hits both structures equally. So the intraurethral pressure stays higher than the pressure inside the bladder.
So the pressure from the sneeze actually helps pinch the urethra shut against its supportive muscular backing.
Yes, it acts as a perfectly sealed, tight valve, utilizing the body's own internal force to prevent leaks.
That is wild. The body is literally using the pressure that would cause a leak to prevent the leak.
Exactly. And the sources actually included data from some fascinating transperineal ultrasound studies to show what this mechanism looks like in real life.
Transperineal meaning they placed the ultrasound probe externally across the perineum, right? Which gave researchers a real-time, completely non-invasive window into how the internal structures move when a patient coughs or bears down.
Yeah, and watching this dynamic movement on an ultrasound, it completely changes how you view pelvic health. During a healthy, coordinated pelvic floor contraction, the bladder neck moves in a very specific direction. They call it ventrocephalad.
Ventrocephalad, which translates to moving forward like toward the pubic bone and upward.
Right, you can actually see the tissue actively lifting and closing off the pathway on the screen. It's really cool.
But the researchers also tracked the opposite movement, didn't they?
They did. When a subject bears down forcefully, performing what the medical world calls a Valsalva maneuver, the bladder neck moves dorsal caudal, or backward and downward.
And the clinical measurements here are where things start to go wrong. The literature uses a very specific metric, a 25-millimeter descent of the bladder neck, as a cutoff point for diagnosing something called hypermobility.
Yeah, the 25-millimeter rule.
I want to make sure we explain hypermobility clearly because it is a recurring theme in these studies.
Well, hypermobility in this context refers to a loss of structural stiffness or elasticity in the connective tissues supporting the bladder neck.
Like an old rubber band.
Perfect analogy. Think of it like a hair tie that has been stretched out too many times. It loses its ability to snap back. So if the ultrasound shows the bladder neck dropping more than 25 millimeters during a cough, or if the tissue takes on this funnel shape, the support system has fundamentally failed.
So the intra-abdominal pressure is no longer evenly distributed. Because the bladder neck has, dropped out of the optimal pressure zone, the force of the sneeze hits the bladder much harder than it hits the urethra.
Right, the pressure differential flips.
And that perfectly tight seal is blown open, resulting in a leak.
Yeah, that is the exact cascade of mechanical failure.
So if stretching the pelvic floor with a tilted pelvis destroys that urethral angle, it stands to reason that we need to look at what tilts the pelvis in the first place.
Right.
Which brings us to a specific posture mentioned throughout the physical therapy guides. Hyperlordosis.
Right, hyperlordosis, which is basically an excessively arched lower back. The pelvis is in an anterior tilt, meaning it tips forward, and the tailbone sticks out behind you.
Like a Donald Duck posture.
Yeah, exactly. And this postural deviation is heavily influenced by the shoes we wear.
Right, the sources explicitly point out that wearing high-heeled shoes is a prime culprit for creating this exact hyperlordotic posture. You put on a heel, your center of gravity shifts forward, and your pelvis is forced to tilt anteriorly just to keep you from falling over on your face.
It's just basic gravity.
But I want to push back on this for a second, or at least play devil's advocate. Women have been wearing high heels for centuries without their pelvic floors spontaneously collapsing. Is the shoe itself really the villain here, or is it a lack of varied, counter movements?
That is a crucial distinction to make. The shoe itself isn't inherently destroying the tissue on contact.
Okay.
The damage comes from the chronic, static nature of the posture. When you wear heels and lock your pelvis into an anterior tilt for 8 or 10 hours a day at the office, you are subjecting the pelvic floor to a sustained mechanical disadvantage.
It makes me think of the structural tension of a trampoline. If you have a trampoline perfectly leveled, the springs all share the weight equally. But if you prop up the back legs and tilt the entire frame forward,
the springs on the bottom edge are suddenly stretched to their absolute maximum limit.
Right, bearing the brunt of the tension.
That captures the mechanics perfectly. When you tilt the pelvis forward, you are drastically stretching the pelvic floor muscles across the bottom of the canister.
And muscles operate on a length-tension relationship, right?
Exactly. Because those muscle fibers are now lengthened far beyond their optimal neutral resting state, their ability to contract powerfully just decreases. They are stretched too thin to generate that strong upward ventrocephalad lift we saw in the ultrasounds.
So the muscle is mechanically disadvantaged. But looking at the biomechanics, it seems the angle of the pressure is just as damaging as the weakness of the muscle.
Oh, absolutely. The change in trajectory is the real danger here. Because the soda can is now tilted forward, the pelvis essentially acts as a slide rather than a supportive basin. Yeah. All that heavy intra-abdominal pressure, when you cough, laugh, or lift, is directed straight downward onto the anterior portion of the pelvic floor. It forcefully overwhelms a bladder neck that no longer has the muscular backstop it needs to stay closed.
Wow. So hyperlordosis, the arched back, the high heels, it stretches the pelvic floor like an over-tightened trampoline spring and blasts the bladder neck with downward pressure.
Yeah.
But, okay, if an arched back ruins the angle by stretching the muscles, slouching should theoretically be the cure, right? Because slouching tucks the pelvis under and shortens those muscles.
You think so?
But the studies in our stack revealed something incredibly counterintuitive about this.
You are referring to the research on hypolordosis.
Yes, hypolordosis,
Mhm.
the classic slumped, flat back, tailbone tucked under posture, a posterior pelvic tilt.
The couch potato posture.
Exactly. It's the exact way most of us sit at our computers or melt into the couch at the end of the day. And there's this fascinating study involving over 200 subjects where researchers used a vaginal sensor to measure actual closure pressure.
Right, intravaginal pressure.
Yeah, they measured it in different seated and standing postures. And the results showed that closure pressure was actually highest when the subjects were in that slumped hypolordotic posture.
It is a phenomenal piece of data because it forces us to look beyond surface-level assumptions.
I really struggled with this section at first, I won't lie. Because, if slouching maximizes the closure pressure around the urethra, shouldn't slouching prevent leaks? Like, why do physical therapists universally condemn slouching if it creates the highest pressure?
Well, to unpack this paradox, we have to differentiate between true muscle strength and positional leverage. Let's look at the electrical activity in the muscle. The researchers measured this using EMG.
And EMG stands for electromyography, correct?
Huh.
Basically tracking the electrical signals the brain sends to the muscle to make it contract.
Yes, high EMG activity means the muscle is firing forcefully. Low EMG means the muscle is barely activating. And in that tucked pelvis slumped position, the pelvic floor muscle fibers are physically shortened.
So the trampoline springs aren't stretched anymore.
Right, they are completely bunched up. And because the fibers are too short, their actual active contractility, their EMG activity, is incredibly weak.
So the muscle itself is barely firing when you slouch.
Exactly. But here's the mechanical trick. Because the pelvis is tucked completely under, the physical angle of the pelvic floor muscles changes relative to the surrounding anatomy.
Okay.
In a slouch, they are positioned perfectly perpendicular to the vaginal canal in the urethra. So even though the muscle contraction itself is weak, the mechanical angle is flawless. That weak contraction squeezes the urethra incredibly effectively right up against the pubic bone. It creates a temporary positional mechanical advantage.
Oh, wow. So you get high closure pressure, not from strong, capable muscles, but just from being wedged into a really advantageous squished angle. You're basically artificially jamming the valve shut.
Jamming the valve shut is an excellent way to phrase it. It relies entirely on skeletal compression rather than dynamic muscular support.
Which brings up the obvious question. If a slumped posture creates this great mechanical wedge, why not just slouch all the time and stay dry? Why is this considered a clinical problem?
Because while slouching might temporarily pinch the urethra shut, it creates a systemic disaster for the rest of the core canister. You are sacrificing the entire pressure management system for a cheap, temporary fix at the bottom.
So the rest of the soda can collapses.
Exactly. When you slump forward, you completely deactivate the transversus abdominis, those deep abdominal muscles that form the structural sides of the canister.
Right.
They essentially go offline because the spine is flexed. And even worse, you trap the respiratory diaphragm at the top.
Okay, I want you, the listener, to try something right now as you're listening. Just notice your breathing for a second. Put a hand on your stomach. If you are hunched over your phone or your keyboard, you are almost certainly chest breathing.
Yep, belly breathing is impossible like that.
Your belly isn't expanding. That means your diaphragm is restricted by your rib cage. It literally cannot descend properly during inhalation.
And in a healthy, neutral body, the diaphragm and the pelvic floor move together in a synchronized rhythm. They act like a piston.
Piston, right.
You inhale, the diaphragm goes down, the organs shift, and the pelvic floor relaxes and gently lowers to accommodate the pressure. You exhale, the diaphragm goes up, and the pelvic floor gently lifts back to its resting state.
But when you slouch...
When you slouch and rely on shallow chest breathing, that dynamic rise and fall rhythm is completely lost.
The piston just seizes up. So what is the biological fallout of losing that rhythm over the course of, say, months or years?
Well, this is where we see a massive influx of chronic dysfunction in physical therapy clinics. Because the pelvic floor is stuck in that shortened, tucked position, taking constant downward pressure from poor, restricted breathing, and never getting to dynamically stretch and recoil, the muscles become hypertonic.
Hypertonic meaning they're constantly tight. They've essentially forgotten how to turn off.
Yes, they are locked in a state of high tension. The muscles are spasming and are completely unable to relax. And the crazy thing is, they might feel weak to the patient, but they aren't weak because they are floppy or damaged. They are weak because they are exhausted from being clenched 24 hours a day.
And this brings us to what I consider the absolute most important takeaway from our sources, the Kegel myth.
Oh, yes.
Because what does every magazine, every well-meaning blog post, and sometimes even outdated medical brochures tell patients to do the second they mention pelvic health issues?
Just do Kegels.
Just do Kegels. Squeeze the muscle.
And for a patient dealing with a hypertonic pelvic floor caused by chronic slouching, prescribing Kegels is actively harmful.
It seems so counterintuitive, though, because we are culturally conditioned to believe that if a body part isn't working perfectly, it must be weak, and therefore we need to exercise it.
Right, work it out.
But based on the hypertonicity you just described, doing Kegels is the exact opposite of what the tissue needs.
Think about it this way. Doing Kegels on a tight, hypertonic, spasming pelvic floor is exactly like trying to do heavy bicep curls when your arm is already locked in a severe muscle cramp.
Oh man, just visualizing that sounds excruciating. You're trying to forcefully contract a muscle that is screaming for a release.
Exactly. It only adds more tension, it significantly worsens pelvic pain, and it completely ignores the root cause of the problem.
Which is the posture.
Yes. If the primary issue is that your slumped posture is forcing your intra-abdominal pressure in the wrong direction, and your muscles are cramped from being locked in a tucked position, squeezing them harder isn't going to fix anything. It just makes the cramp worse and further restricts blood flow to the tissue.
So squeezing a cramped muscle doesn't fix the directional pressure problem. You have to fix the posture to fix the pressure. You have to let the muscle lengthen and relax before you can even begin to strengthen it.
Right. Restoring the neutral alignment of the spine is the only way the diaphragm and the pelvic floor can communicate again. You have to rebuild the integrity of the core canister.
That makes total sense.
That ensures that when the intra-abdominal pressure spikes, like when you sneeze or lift something heavy, it is distributed evenly to maintain Enhorning's valve mechanism, rather than blowing the bladder neck open or forcing the pelvic floor into a chronic painful spasm.
Okay, let's summarize the journey we've just taken through this research. Because we started with the simple everyday act of sitting down, and we mapped out how tilting your pelvis completely rewires the pressure system inside your abdomen.
The biomechanics change entirely depending on the foundation you set with your spine.
Right. We've learned that maintaining a neutral spine isn't just about, avoiding a sore lower back or looking professional at your desk. It is fundamentally about ensuring that your intra-abdominal pressure properly seals your bladder neck shut.
Whether you are arching your back in high heels and stretching the trampoline springs too far,
Or slumping down in your office chair and artificially jamming the valve shut while paralyzing your diaphragm, the end result is the same. The core canister fails.
preserving the structural integrity of that canister is the key to long-term pelvic health. It's about dynamic pressure management, not just isolated muscle strength.
So the next time you catch yourself slouching over your laptop or you're getting ready for an event about to slip on a pair of high heels, I want you to visualize that pressurized soda can. Think about your diaphragm, think about your pelvic floor, and consider, where is all my internal pressure being directed right now? Am I supporting my bladder neck or am I overwhelming it?
And, looking at the totality of these sources raises an important final question. Throughout all of the biomechanical literature and physical therapy data, there is a massive emphasis on functional dynamic movement. Our body's pressure management relies entirely on the coordinated rhythm between the diaphragm, the spine, and the pelvic floor. It relies on the piston moving.
It requires variability. Breathing, walking, shifting weight, all of that.
Exactly. So perhaps the true root of the modern pelvic health epidemic we are seeing isn't a lack of muscle strength, and it certainly isn't a lack of Kegels. Perhaps it is a fundamental evolutionary mismatch.
The idea that our anatomy simply hasn't caught up to our modern lifestyles.
Yeah, we are taking a complex anatomical system, the human core canister, that evolved over millions of years to manage pressure through walking, squatting, running, and constant dynamic movement. And today, we are forcing that same anatomical system to sit completely static in ergonomic office chairs for 8, 10, 12 hours a day.
Right. The pelvis evolved as a mobile, dynamic basin to catch and support our organs while we move through the world. It didn't evolve to be locked into a forward tilt or a backward slump for a third of our lives.
Yeah.
It's a completely unnatural environment for the body to survive in without mechanical consequence.
The human body adapts to the positions we put it in most often. If we put it in a static slump, it adapts by locking the tissue in tension and shutting down those dynamic pressure valves.
Which brings us right back to the question we started with. Chances are you are sitting down right now. So how is your posture?